speaking to all of you is to give you sort of an unbiased perspective on multiple fillers out there. I'm not representing any company today or any injectable company, and kind of to give you my insight, my experience on what I've seen with lip augmentation, because truly when you look at the face, the lips are one of the hardest things to nail spot on. So hope you get some tips and tricks for becoming better injectors. You know, what's in your toolbox? This is really translatable to many aspects of not just your medical career, but life. But, you know, there's many dermal fillers out there, and it's very difficult to keep them straight, especially when you're a novice injector and you're just starting to, you know, dabble in injectables. So, you know, at the end of this, I want you to kind of know what's in your toolbox and how to use it. Not every lip is the same, and that's really important here because you can see very distinct, different characteristics on all of these lips. We have youthful lips with subtle volume loss on the left that just need a little augmentation. And on the right, you can see signs of an aging lip, and the lip doesn't always age symmetrically. So you may see that, you know, the upper and lower lip are losing volume symmetrically. Sometimes the lower lip, as you see on the right lower one, is really developing an asymmetric volume loss. I'm a huge fan of anatomy. If you're going to be an injector, you really need to know where you're placing your filler and the anatomy that you're trying to enhance and also protect on the lip. And so, you know, we look at just a few of the things. The Vermilion Border, which is that white roll that really separates the cutaneous portion from the red lip. And a lot of people want to accentuate this during their, when they augment a lip. And the Cupid's bow as well. Not everyone has a Cupid's bow, and if they don't have that, it's actually very difficult to recreate that. And we'll see that in some patient slides that I have for later. Oral commissures are really important. As we age, they start to turn downward. That's from loss of support, and that's also from the muscle contraction, the depressor annuli oris that's bringing it down. So there's ways that we can augment this, provide support, and really rejuvenate the lip. I apologize if this slide isn't particularly easy to see, but the point that I wanted to make on this is this is a sagittal view, or a little slice of the lip, and the level that you want your injection to be, and we'll go into this deeper in future slides, but you want it to be submucosal. So you can see in the center of the lip is the orbicularis muscle. You really want to be superficial to that in your augmentation. Where people get big bruises and they get into problems with lip augmentation is where they're directing their needle through the orbicularis, and that's setting them up for vascular occlusion as well as a suboptimal result coming out. And so you really need to know the physics behind the filler and why you would use it. And so when you examine a lip in the office, you need to determine how much volume do you need, and really what are you trying to achieve? Are you trying to enhance a certain characteristic of the lip? Is it more of a global approach that you're trying to rejuvenate? And in general, this isn't always the case, a younger lip is typically a fuller lip. And as we have already established, every lip shape is very different. So that isn't a stereotype, but an older lip typically has marked volume loss. It needs a little more help, and it needs a stronger filler within the lip. Thin filler is typically preferable, and we'll go over properties of fillers. Because it incorporates into the tissues very well. This is a very thin surface. You don't want to use something that's extremely thick because that's going to set you up for lumps and bumps if you don't distribute it quite well. And then the numerous brands, which we'll go over. So there's two properties of fillers I want to discuss with you really quickly. One of them is cohesivity. Now, cohesivity is really how well does a filler stick together when you inject it. And you can see that this is from a study, and what they did is they dyed a filler blue, put it in the solution, and shook it. And so the least cohesive filler disperses, and it becomes fully dispersed within the liquid. You can see a highly cohesive filler, when you shake it, despite agitating it, sticks together. And we'll look at different fillers and which ones have more cohesivity than others. G' is the other one. This is probably, to me, a little bit more important of a characteristic when you're looking to augment lips, because it is the true lifting power of the filler. It is how hard that filler is. And so, remember, lips have very thin skin. Now, a high G' filler may be appropriate for some lips because you do want to project it, you do want to create support, but that's not the same for every lip. And you can see on this little diagram here, you know, some of the more common fillers. Juvederm Ultra and Ultra Plus has a slightly lower G'. Doesn't mean it's a low G' because it is quite a powerful filler for Ultra Plus. but Restylane, and then Radius, which we don't use for lips. Again, anatomy, you need to know where the facial artery is. So it's a tortuous vessel. It is variable in its course within the face, but usually it is about 2 centimeters from the oral commissure, and it gives off a superior and inferior labial artery, which supplies the blood supply. Now, what I want you to take from this is the artery isn't entering from the corner of the mouth. It's actually coming in from a little deeper and entering about 1/3 of the way into the lip. So putting your needle at that corner, that oral commissure, and keeping it submucosal, you're decreasing your chances of getting into an arterial or a venous situation for bruising. We can see clear signs. This is a classic aging lip. I see this all the time in my practice. The upper cutaneous portion of the lip becomes elongated, so it looks longer and droopier. You see the downturn oral commissure, as we already said, that's lack of support from volume loss and also from the depressor anguli oris bringing it down. Volume loss in both the upper and the lower lip, not always symmetric. And then not so apparent in this, but regardless if you're a smoker or not, just the pure muscular contraction periorally is going to start causing vertical rhytids if you don't reestablish support to that area. Respect proportions of the lips. That's the main thing I want you to take from this. And if you don't, you're going to get someone that truly does think they're a mess, and they kind of look like a mess. It's really difficult when you see this. You know, someone that comes in, she's had previous lip injections, she has a marked asymmetry, she's very unhappy with it. And you have to kind of figure out, well, how were you beforehand? You know, because people forget what their baseline was. And so when you see this, she's mid-50s, you know, volume loss in general, but we can see asymmetric Cupid's bow. Her left bow is sitting a little bit lower. This elongated asymmetric left upper lip. And so I used 1 cc of Restylane, but very asymmetrically. And this is tricky because your mind does not want to do anything asymmetrically, but you got to wrap your mind around it that she needed 0.4 of a cc on the left lip to provide that support and get it everted. I actually had to put a little bit along her vermilion to help get a little eversion. And also her left lower lip needed a little bit more because it just was a little bit asymmetric on that side as well. But this got her to where she needs to be. Again, a thicker filler, higher G prime, she needed support. If you would have put a Restylane Silk in here, you probably wouldn't have gotten the amount of lift and the amount of contouring that I got with a stronger G prime filler. This is someone, you know, you probably look at her and go, well, you don't really need a whole lot, but she thinks she does, and you know, she's got good proportions, and she wants a little bit more hydration with her lip. So subtle enhancement. You don't want to overfill these because you don't want this to become disproportionate on her face. She does have myophiltral columns that, you know, we could define a little bit more. A very defined Cupid's bow, so that helps us a lot. And good volume. So I used Bobello in her, very little volume, 0.6 cc's. I put a little bit within her philtral columns to give her a little bit of definition. And you can see that all of those fine lines along both her upper and her lower lip are just expanded. So her lip just looks more youthful. I didn't really add a whole lot of volume per se, and that was the point. I wanted something mildly cohesive that was going to incorporate into the tissues very nicely. This is, you know, someone who had got previous injections. She was a smoker. To me, disproportionate. Her upper lip seemed a little bit disproportionate to her lower lip. She was over-augmented, in my opinion. A little bit too much vermilion, and in contrast to the rest of her lip. So she's a good patient, needs support. Whenever they're a smoker, I probably give them a little bit more support anyway, because they're going to have a lot more perioral working, you know, and may need something a little bit stronger. So disproportionate lower lip, defined vermilion. I didn't put what I used, but I used Restylane in her. And I filled her lower lip a little bit more to get her in proportion. I didn't touch her vermilion border, but I filled the actual body of her lip. I apologize, the lighting's a little off, but you can see she's more proportionate in the after. Now this is someone, it's not the best picture for her. She actually was from a training, and I had done her needle marks are from the training, but I hadn't done anything to her lip yet. But this is a perfect example of someone, mid-60s volume loss, both the upper and lower lip, elongated border, and vertical rhytids. And I just took a picture of her right after we did. I used Juvederm Ultra Plus in her. So again, a high G prime, you need support, higher cohesivity with it. And so she was able to get a little bit more augmentation.